Do you have a strange little bump somewhere on your body that you've never bothered to look up? By the end of this video, you'll probably be able to name it. Today, we're covering the most common benign skin growths people ask about in clinic, what they are, why they show up, and what your realistic options are for dealing with them. Skin tags. Let's start with skin tags. These are small, soft flaps of skin, usually flesh-toned or a bit darker, and they love to show up wherever skin rubs against skin, the neck, armpits, eyelids, under the breasts, and in the groin folds. Most are tiny, just a few millimeters, though occasionally one will grow to a couple of centimeters. Structurally, a skin tag is just a little pouch of completely normal skin. Nothing abnormal is happening at a cellular level. Anyone can develop them, but they become more common with age, and there's a genetic component. If your parents had a lot of them, you're more likely to as well. They're also seen more frequently in people with insulin resistance. Do you need to remove them? No, they're harmless. Reasons to remove one might include constant irritation, snagging on jewelry or clothing, or if it becomes twisted and starts to die off while still attached, which can be uncomfortable. Removal for cosmetic reasons is also completely reasonable. A doctor can freeze it, snip it with surgical scissors, or cauterize the base. What you want to avoid is the at-home tie-off kits sold online. They can work, but infections from DIY removal are common enough that it's worth just booking a quick appointment instead. Seborrheic Keratoses. Next, seborrheic keratoses, sometimes nicknamed age spots or wisdom spots. These are brown, grey, or black patches that look almost stuck onto the skin's surface, waxy, rough, or crusty, and often mistaken for warts. Unlike skin tags, which involve the full thickness of the skin, seborrheic keratoses only involve the outer layer, the epidermis. That's why they sometimes flake off on their own without bleeding. There are no blood vessels that shallow. 3 things drive their formation: time, genetics, and UV exposure. You can't do much about the first 2, but sun protection helps with the third. Treatment isn't required unless one is irritated or cosmetically bothersome. Options include shaving it off with a blade, laser, cautery, or freezing. Thin ones tend to come off cleanly with little trace. Larger, deeper ones are more likely to leave a flat scar. Interesting detail: removing one from the scalp usually doesn't affect hair growth because hair follicles live deeper in the skin than these lesions do. Dermatofibromas. Dermatofibromas are firm, scar-like nodules that typically form after some kind of irritation to a hair follicle, most often on the legs, where shaving is a frequent trigger. Press on one, and you'll notice it's quite hard, and some people find them tender or itchy, especially when bumped. These sit deeper in the skin than seborrheic keratoses, which is why freezing or lasering, techniques suited to shallow lesions, don't work well on them. Full removal generally means surgical excision, and that trade swaps a firm bump for a surgical scar, which isn't always an improvement. The better first step is usually figuring out what's irritating the area: friction, tight clothing, repeated picking, and removing that trigger. Surgery is best saved for cases that are genuinely bothersome. Milia. Milia are tiny, firm, yellowish-white bumps just under the skin's surface, and they're constantly confused with whiteheads. The difference matters. A whitehead forms inside an existing hair follicle that has a natural opening, so squeezing can actually clear it. A milium, on the other hand, is a small self-contained cyst with no natural opening at all. Squeeze all you want, even if you break the skin over it, the little sac that produces the material is still there, and it will likely reform. Milia show up most around the eyes and cheeks, and are especially common after some kind of skin disruption, minor trauma, a burn, or resurfacing procedures like lasers. Regular use of retinoids and gentle chemical exfoliants can lower your risk of new ones forming, but once one exists, skincare alone won't clear it. In clinic, the fix is a tiny nick in the skin, followed by extracting the entire sac, done properly. Recurrence in that exact spot is low, though a new one can always form nearby. Sebaceous Hyperplasia. Sebaceous hyperplasia shows up as small, yellowish or skin-toned bumps, often with a subtle central dimple, most common on the forehead, cheeks and nose, areas dense with oil glands. That's literally what these are, enlarged oil glands. Under magnification, you can sometimes spot small yellow lobules, which are the enlarged glands themselves. They're more common with age and in people with naturally oilier skin. Treatment is simple. A light touch of electrocautery can shrink the gland with minimal risk of scarring, though this isn't a DIY project. One important note, these are sometimes mistaken for basal cell carcinoma, a common skin cancer. Most dermatologists can tell them apart at a glance, but if you're ever unsure about a lesion like this, it's worth getting it checked. Molluscum Contagiosum. A similar-looking bump in children is often something different. Molluscum Contagiosum. These are small, smooth, pearly bumps with a central dimple, but unlike sebaceous hyperplasia, they tend to appear in clusters, favor skin folds, armpits, groin, behind the knees, inner elbows, and are caused by a virus spread through skin contact. Kids usually pick these up once, often through play at school or daycare, and the immune system typically clears them eventually without treatment. The catch is that they're often intensely itchy, and scratching spreads the virus to new spots, which is why many doctors offer treatment anyway. One common option is a topical extract derived from a beetle species that naturally produces a blistering compound. Applied to the lesion, it raises a small blister in the outer skin layer, causing the molluscum bump to detach, and it also seems to accelerate the body's immune response to the virus. Venous Lakes. Venous lakes are soft, dark blue or purple spots, typically on the lower lip, the upper ear, or other sun-exposed areas of the face. A telltale sign, they flatten or fade when you press on them, because they're essentially small pools of dilated veins, usually from a combination of minor trauma and cumulative sun exposure. They don't resolve on their own and can slowly enlarge. Because they're harmless, treatment is optional, but if you want one removed, a vascular laser or light electrocautery generally works well. Cherry Angiomas. Cherry angiomas are extremely common, small, bright red, dome-shaped bumps, most often found on the trunk, chest, and arms. Where a venous lake is one dilated vessel, a cherry angioma is a small cluster of tiny blood vessels bunched together. Genetics and age both play a role, but nearly everyone develops at least a few over a lifetime, and having several doesn't signal an underlying health problem. Removal is quick and satisfying. A bit of numbing followed by a brief touch of low-setting cautery seals the vessels and typically heals cleanly. There's no reliable way to prevent new ones from forming over time. Warts. Finally, warts, caused by strains of human papillomavirus, HPV, spread through direct contact. The most familiar type is the plantar wart, found on the sole of the foot, where constant pressure from walking can make them genuinely uncomfortable, like stepping on a small stone. 2 clues help tell a wart from a callus. Warts often show small black dots at the center, tiny clotted blood vessels feeding the growth, and the natural skin ridgelines, the same pattern that forms fingerprints, curve around a wart instead of running straight through it, since a wart pushes normal skin outward rather than just thickening it. Warts are worth treating because they can persist for years, cause ongoing discomfort, and are contagious, capable of spreading to other parts of the body or to other people. Unfortunately, no single treatment is reliably fast. The sheer number of available options in dermatology references is itself a sign that none of them are universally quick. At-home options include high-strength salicylic acid treatments, well above the roughly 2% found in everyday over-the-counter washes and creams, often in the form of a medicated pad placed directly over the wart and left in place, sometimes reinforced with tape to keep the area sealed and consistently treated. Some warts resolve in a few weeks. For many people, it realistically takes months. In-office options are more varied and include freezing, cautery, careful paring down of the tissue, chemical treatments, and laser therapy, worth pursuing if at-home methods haven't made progress after a reasonable trial. Wrap-up. That covers the most common benign bumps people ask about: skin tags, seborrheic keratoses, dermatofibromas, Milia, Sebaceous Hyperplasia, Molluscum Contagiosum, Venous Lakes, Cherry Angiomas, and warts. Most of these need no treatment at all, but if something changes shape, color, or starts bleeding, that's always worth a professional look rather than a guess.